One of the most common barriers to accessibility of mindfulness programs with a trained mindfulness professional is funding. It can seem very expensive to take a course like MBSR or MBCT, but research shows that it is actually one of the most cost-effective ways to deal with various issues, and not just mental health ones. Hi, everyone. My name is Ted Meissner, and welcome to Mindfulness Voyage. I'm glad you could be here. And today we're going to be speaking about efforts to include mindfulness programs for reimbursement by insurance. And this is a very complex story, so I'm eager to get involved with that. And please do note, if you like this kind of podcast, and if you want to support it, it doesn't mean having to make a donation. You can support this by just tapping the subscribe button or like. That itself makes a huge difference. Also, apologies for some of the sound on my side of the conversation. I've taken out as much of that clicking as I can, and I'll be watching for that in the future. Thanks so much, and let's get started. Our guest is Eric Loucks. Eric, welcome to the podcast. Good to see you. And as you know, I've been looking forward to this for quite some time. So thank you for being here.
Yeah, my pleasure. Really appreciate you offer this podcast along with everything else you do in the field to build community and evidence-based approaches to mindfulness interventions. So happy to be here.
Glad you could be here. And before we dive into our very complex and meaningful topic for today, maybe you can say just a little bit about who you are and where you work.
Sure. Yeah. So I'm a professor at the School of Public Health and the Medical School at Brown University and director of the Mindfulness Center there. I've been doing research in mindfulness interventions for about 15 years or so, and then I've been personally practicing mindfulness for about 25 years or so. And I am trained in like cardiovascular physiology and epidemiology and like study design methods, that kind of stuff, and try to really bring a lot of methodological rigor to the study of mindfulness interventions, but with an eye towards implementation. And so I think part of what we'll be talking about today is one of our NIH grants and one of the papers that came out from it around really what it would take for health insurance coverage of mindfulness-based stress reduction.
Yeah, that's great. And one of the things I appreciate most about who you are and the work that you do is what you mentioned around methodological rigor. And I still remember Richie Davidson years ago at the UMass, one of the scientific conferences, saying we really need to step up our game on that. And so thank you for carrying that forward. And maybe you could just say a little bit about how this paper that we're going to be talking about, how did that come about? Because we know that there are a lot of different areas that have a common interest in this.
Yeah. Yeah, we received a pretty good sized grant from the National Institutes of Health focused on like an implementation science angle to mindfulness-based stress reduction, where what we did is used an approach called integrative knowledge translation, or IKT, which basically means that when we're developing or evaluating interventions, how can we bring forward into the conversation all relevant community members, including in this case around MBSR and its potential health insurance coverage. Let's be talking with policymakers and health insurers and clinicians and patients and MBSR teachers. And so what we did is we created an advisory board of members from all those different areas and asked them their recommendations on what they felt would be important in order for MBSR to be considered for health insurance coverage. And we've been publishing a series of papers off of those focus groups and in-depth interviews. The most recent one that just came out about a month ago or so.
Yeah. And for those who are watching this or listening to it later on, this particular paper that we're talking about, I do link this in the description so you can take a look at that. And I'm glad you mentioned about the key stakeholders and some of those roles. And I'm wondering if we might just take a slight sidestep on a little bit of that, and maybe you could share some of the insights in the crafting of this and these discussions you had that they might have shared that were maybe interesting to you, or new information,
Yeah,
and certainly important information in what you're doing.
sure. Yeah, and in many ways, I feel like I'm here trying to represent the 26 members of our advisory board and their voices and their wisdom. And the paper is a qualitative paper, and one of the other ones is like a mixed methods paper with quantitative too, but we actually have quotes from them in it. I think, one of the things that we were asking about is, what are some conditions that might help MBSR be covered by health insurance, and also what are some barriers to it? And so one of the pieces, that did come forward was just like the value of research findings that both policymakers as well as just members of the public and clinicians really did value research. One government policymaker shared, I'll just quote this person, shared that they're interested in a broad 30,000-foot outcomes and noted that, I'm sure that there's meta studies out there that aggregate a lot of those kinds of smaller studies, analyses, and bodies of work. I'd point to that first. And so that they're often looking for these big picture syntheses. Another piece that that gave me some pause was, I was talking to one staffer of a state senator, and this person was sharing, before I would take this to my boss to consider for policy on health insurance coverage for MBSR, I'd want to know what the American Medical Association thinks about this, or the American Public Health Association, or the American Psychological Association. So, what are their policy statements or evidence statements on that? And that is a gap in the field right now. And so, the call right before this was with the American Public Health Association, actually, where we're on a committee that is proposing a policy statement for MBSR health insurance coverage that's evidence-based, and so we're currently working with that organization for them to consider it. It's not approved yet that they will allow that, but we're in the middle stages of proposing that. So that's like another piece that came up. Another health insurer said, how did it roll out in other countries? For places that actually reimburse for MBSR, what were their lessons learned? What went well, but also what didn't go well, so that if we're gonna offer that in the United States, let's just learn how it went in other countries so that we're not repeating mistakes and that we're building on successes too. So those are some examples that came up in the conversations.
Yeah, and it's interesting because that brings in its own complexity. Like with this last example, different countries have different ways that they pay for health
Yeah.
insurance, and different, completely different models than we have here in the US. And also that other piece about getting statements from various mental health organizations about this. They are often not mindfulness people, that they may also have a bit of a conflict of interest in that mindfulness is a different discipline than theirs,
Hmm.
and maybe something that they have some bias around, perhaps not wanting that in there. And that's not saying that's the case, but that can influence what they may have to recommend. I know often in many of the studies that I'm posting about on LinkedIn, and you read these as well, about studies that compare a mindfulness intervention of some sort as being, shall we say, comparable
Mhm.
to treatment as usual. That treatment as usual is usually talking therapy by those organizations.
Mhm.
So it can also be seen as a bit of a challenge to what they're running into. And I'm curious about what are some of the other conditions that may promote MBSR being covered, and if there are some other challenges to be met that's also come up in these discussions. What are some of those too, if you can share?
Sure. Yeah. I mean, one thing that came up was, interest in how MBSR compares to alternatives like psychotherapy and like medication. And so, I often see it as, if we see like CBT is really well respected and evidence-based. And so if the effects of, say, MBSR are similar to CBT, uh, in many ways, the way I look at it is it gives choice for someone who wants to learn one-on-one maybe with a therapist, for example, CBT could be really good, and that's great. And if they are more drawn to, say, a mindfulness-oriented approach that's maybe in group, then if there's equivalency of effect, that is interesting too. Comparing to medications, we had like Dr. Liz Hoagie on a seminar we provided last week at the Mindfulness Center at Brown, and so she did a study, randomized controlled trial comparing MBSR to Lexapro for folks with anxiety and found non-inferiority between the two. So they were pretty similar. Actually, the curves were almost completely overlapping in terms of the reductions in anxiety. But what was pretty interesting to me is actually the side effects were much less with MBSR than the Lexapro. And so once again, in many ways, it can, again, like part of mindfulness is like non-judgmentalness, and curiosity and kindness, including towards ourselves. And so if someone's drawn to take Lexapro for anxiety, totally do that. And it's equivalent. And if someone's drawn to try MBSR, then that seems like a potential opportunity too. And if someone is experiencing adverse effects, say with a medication, it may be that mindfulness interventions have less of that. It's not that mindfulness interventions are free of adverse effects. We need to be careful around that too, and to be trauma informed and all those approaches. But that's some of the things that some other examples of what came up.
Yeah, and I'm glad you brought up Liz's work on this with the escitalopram or Lexapro under its brand name, because that's often one that comes up as this is listed as non-inferior and with fewer and less severe side effects. And it's the important thing when we're talking about choice here is that it's choice of demonstrably helpful and useful treatments. It's not just, hey, my Bob said if I drink XYZ kind of juices that will cure my whatever it is. No, things that are validated, controlled, and have decades of research behind them, as MBSR does. So I'm also curious if there have been some discussions around more broadly than the United States, because you've mentioned there have been questions around what did it look like in other countries, and that kind of thing.
Yeah.
You may not have a great deal of solid information on what's coming in other countries, but I'm wondering what are some of the things that you would like to see happening just for the world with MBSR and other demonstrably helpful programs with various conditions that people are running into.
Yeah. Yeah, that's a big question. Good one. I think there's some countries like, say, Singapore, where they provide reimbursement for folks that go through MBSR. It's not like full reimbursement, but partial, so that brings the price down quite a bit. There's also other countries I understand, like Germany and Switzerland, that also provide some reimbursement for it. And so there are models where it is happening. I think, one of the things that came up a lot with our focus groups were themes around what's called the triple aim. So when health insurers are considering covering a program, they're often looking at the health impacts, the costs, and the patient experience. And so, we've got quite a bit of evidence now on the health impacts. The cost, I'm aware of, we're actually doing a systematic review on this right now. And I think we've identified 12 papers that have looked at costs of MBSR, and we're hoping to submit that within about a year or so. But a bit of the spoiler is, the evidence is pretty promising so far. There's just not as much of it as I'd like, and some variation in the quality of the evidence. But I think most papers are showing actual cost benefits. And then the patient experience is an interesting one. This MBSR, was developed over 40 years ago, and society is a little different now, including how much time people want to spend on a program. So classic intervention length is 2.5 hours per session, 8 weeks of that, plus an all-day retreat. So it adds up to about 30 hours. And some people can balk at that amount of time. Sometimes I think about the average amount of time that folks spend looking at screens and social media every day, which and
Yeah.
television, which I think is around 7 hours. So probably we could find that time that could potentially transform your life in more ways than maybe looking at television for that amount of time. But
Exactly,
again, mind
Eric.
does
And
that. Well, it's not me to say how everyone should spend their time.
it's where are you spending your time? What is
Yeah.
the, if we look at this again, even more classically, what are you nourishing yourself with?
Yes.
Your mind and your heart. Uh, and and that's an important aspect to it as well, is that it's not a treatment for just one thing that you may be having some difficulties with.
Hmm.
That we know from, again, decades of research that MBSR in particular and other programs as well can have effects on a wide variety of different things that people are running into. It's more than just stress, depression,
Yes.
anxiety. There are physiological conditions. You know this yourself, having published papers on, I think, heart rate variability for as one example in this. And the list goes on and on.
Mm-hmm.
And while yes, we do need to up our game on the rigor of the science, just recently had a couple of podcasts that are describing exactly that, and some things that are happening in the field. So much more to come on
Yeah.
that.
Good. Yeah. And I
So
think
you're,
maybe some flexibility around the amount of time that folks, especially for smaller classes, like group medical visits, for example, can often be smaller, like around 12 patients, for example. So if we can be bringing the class duration down even to like a 2 hour block, that can sometimes be a little better. And I know there's even explorations below that. And I also do wonder, people are craving community so much these days, and loneliness levels are like sky high. And I think there has been a pendulum swing towards shorter and easier and faster in the mindfulness interventions. But then we also see work by folks like, say, Matthew Sackett at Harvard that's looking at really advanced meditation practices. And we've even developed like a follow-on program, as have folks at Oxford and others, so that there's also maybe a pendulum swing towards higher dose stuff as well. Because for those of us that have been, practicing mindfulness for decades, 8 weeks is, a flash in the pan compared to, decades of practice. So it is a moment where I'm trying to respond to society's desires and to be really efficient and cost effective. And then also just to respect the amount of time it may actually take to get mastery over some of these concepts and apply them that can in ways that have the potential to transform our lives and our health.
and this can potentially lead to more specialized programs, because as we know, mindfulness is not just one program. There are lots of different ways in which this might be approached, and different kinds of practices, or the order of practices we still have and use in programs like MBSR can make a difference depending on what kind of difficulty you're running
Yeah.
into. As we had in a recent podcast, not just one kind of anxiety. There are different causes and conditions, and so there's much more fine tuning that I hope will be coming in a fashion that is covered by insurance, because it saves the insurance company money in the long run, certainly. And we again see more and more indications of that. So Eric, I'm wondering if what are some other things that you would like to share with viewers? If there are other things that maybe some of the stakeholders have shared, or other things that are just in your head and heart about this research, maybe what you'd like to see come of
Yeah.
it.
Yeah. I think, I always want the evidence to drive the policy. And so we're either looking at evidence syntheses that have already happened or we're developing them ourselves. But I do think if we want evidence-based mindfulness practices to be supported by health insurance, it is going to be a bit of a movement that'll be required because, say with the pharmaceutical industry or something, there is a group that'll make a decent amount of revenue off of, say, the FDA approving a particular pharmaceutical or surgical tool or whatever. With MBSR, no one's in it really for the money that I'm aware of, who these folks that are doing it really well. And there's no one entity that's going to be getting rich off this stuff. It's more out of service and for folks that are working in this field to feel like they're working in an area that has impact and that has meaning. And they're sometimes okay with having a lower salary because of that, because they feel like they're having impact. So I think if we want health insurance coverage for that, it does take action, and it takes a community to do that. And so for us to be considering ways that we can work together as a community, if that's something that is wanted. And so there's certain things like, say, uh, there's a particular code that I'm just pulling up in my notes here. So, for example, one of our advisory board members who had experience in policy talked about, these Medicaid 1115 waivers. So this can be at the state level, for example, where you can work with Medicaid where they will provide a waiver for that state to allow testing of some kind of innovative program that may be of health benefit to the population and also potentially reduce costs. So Medicare and Medicaid is pretty interested in costs because they pick people up in the last decades of life. So for some of the private health insurance companies, everyone's interested in costs. I think one of the challenges with Medicare and Medicaid is that the health insurance companies often have to get people to age 65 or whenever it is that Medicare and Medicaid picks up, and then it's Medicare and Medicaid's problem. And so there's certain things we could do earlier in life that could have reward for decades, that the way the system is set up, the private insurers are just due to their financial model and everything is just a little less compelling. Unfortunately, it's not that they don't want to do it, it's just the realities of the financial model. So sometimes working with Medicare and Medicaid can be a way to help, and maybe one of these 1115 waivers that can be negotiated at the state level. So for each of us in potential different states in the United States, if we have connections there, for example, and that can be piloted, then the evidence can help inform other states about if they want to pick it up. And so there's approaches like that that can be helpful. Similar, I have connections with the American Public Health Association because I'm at a school of public health and have colleagues in there. But for listeners, what professional organizations are you members of? And sometimes there's just working groups that are really focused on mind-body wellness, for example, and they're looking. Enough groups are actually looking for policy statements to write that are meaningful. And so if you're connected in with a group like that, that is something that policymakers have actually called for. I think other ways can be to just see what's worked elsewhere, like say with social emotional learning in childhood, and that's now covered, or, lifestyle medicine, like Dean Ornish's program for cardiac rehab. He spent a lot of time in Washington advocating for that, and it had good quality evidence behind it. And so just seeing what's been successes around other entities that are maybe a little more similar to MBSR than, say, a pharmaceutical product can also give us strategy ideas so that we're not like reinventing the wheel to get this stuff done, but we can see how other groups have gotten it done, and then to ask ourselves, am I drawn or do I have the skills to contribute to this effort? And if so, to consider doing that, because I think we are at a moment now where mindfulness has become quite a bit more mainstream. The members of our advisory board, including health insurers and policymakers, were generally quite enthusiastic about this. Without one individual or one company set to make a whole lot of money out of it's a lot of us just working out of the goodness of our own hearts to get this stuff done. And there is, certainly could help to a certain degree allow livelihood for ourselves. But it's more drawn from what we see as maybe a public health or population health benefit at this point.
Yeah, and this is one of the advantages I see to mindfulness programs being reimbursable, is that it's a bit of the opposite kind of model than we have with a particular medication, where a pharmacological institution, a company owns that and will have the pricing to maximize profit. And that's not at all what we're doing within mindfulness, that programs are kept at levels which do make it cost effective and do help people long term, and especially if they have opportunities to continue on with the practice and learn more.
Yeah, I think one other piece that a number of people are working on is how to, rather than trying to fit health insurance to MBSR, how can we fit MBSR to the existing health insurance paradigm? So, for example, Natalie Marone, who's a professor, has with a large team, has an NIH grant, including with Isabel Roth at UNC Chapel Hill, to evaluate MBSR delivered through clinical practices as a group medical visit for, I think it was for lower back pain. And so they did shorten MBSR duration. I think they removed the all-day retreat, for example, so that they could fit it within a reimbursable model that's immediately reimbursable by health insurance. And their papers are about to be published, and they're not able to talk about them much yet. But I am seeing excitement in the researchers about what is to come. So keep an eye out for that group's work as it comes. And that's another model of how can we adapt MBSR in ways that just fit within the current health insurance system that already has billing codes, say billed as a group medical visit. It does have challenges in that someone needs to be a clinician to offer it at this point. So for MBSR teachers that have gone through rigorous training programs but aren't clinicians themselves, that could pose a challenge unless they get some sort of arrangement with the clinicians where maybe they're in the room with the clinicians and they're sharing some of the revenue or something. There are some potential workarounds, but that is another approach that is being explored right now that looks like it could be quite fruitful too.
So exciting times coming. For those who are watching, we're going to have several links in the description for this episode. And Eric, thanks so much for being here, and I hope you come back to tell us how are things going as this continues to unfold.
Yeah, thanks. Yeah, I really appreciate being here and you hosting me, Ted, and all the work that you do in the field too. So thank you.
Thank you so much for joining today, and I hope this was an interesting conversation for you. It certainly was for me, and there's more to come on this. I am hopeful for a future where people who know that mindfulness is a choice that they would like to explore, science-based, based in evidence about what we know can be effective for most people, if not all people in certain circumstances, then yeah, I'd like to see insurance companies understand that this also helps them too. Remember, every moment you have a choice, make it the best you can. And I'll see you soon on Mindfulness Voyage.